Greetings to everyone. Today I, Kamesh Arun of batch 1942LA1 under the guidance of Assistant of Pathology Department Margarita Mandal ma'am is here to present my views on the topic Hodgkin lymphoma. So these are the contents of the presentation which we are going to discuss today. So first will be the introduction. Hodgkin's lymphoma, also called lymphogranulomatosis or Hodgkin's disease. It is a malignant disease of the lymphoid tissue whose distinctive morphological features are characterized by the presence of neoplastic giant cells called the reed-sternberg cells. Etiology: it can be infectious, genetic, or occupational. What are the signs of Hodgkin's lymphoma? Lymph node enlargement, cachexia, splenomegaly, hepatomegaly, or jaundice. Localization of pathology. As you can see clearly, the pathology is majorly localized in the lymph nodes. Reed-sternberg cells, also called the RS cells. Here is a typical example of an RS cell which is binucleated with large inclusion-like nucleoli and abundance of cytoplasm. There are several morphologic variants of RS cell characterized by different histologic subtypes of Hodgkin's disease. Let's see them one by one. First is classic RS cell. It is large in size. It can be bilobe or it can be multilobe. Each lobe of the nucleus contains a prominent eosinophilic inclusion-like nucleoli and abundance of cytoplasm, giving it an appearance of an owl-eye, as you can see here. The second one is the lacunar type of RS cells. They are smaller in size. In addition to the above feature, has a pericellular space or the lacuna in which it lies, which is due to the artifactual shrinkage of the cell cytoplasm, as you can see here. The third one is the polyploid type or popcorn or lymphocytic histiocytic, that is L and H RS cells. This type of RS cells is larger with lobulated nucleus in the shape of a popcorn, as seen here. The fourth one is pleomorphic RS cells. As the name suggests, have a bizarre polyploidy of nucleus, as you can see here. So now let's see the classification of Hodgkin's disease. According to WHO, Hodgkin's disease is divided into two main groups. The first one is classic Hodgkin disease. The second one is nodular lymphocyte predominant Hodgkin disease. The classic Hodgkin disease is further divided into lymphocyte rich type, nodular sclerosis type, mixed cellularity type, lymphocyte depletion type. First one is lymphocyte rich type. It is characterized by the proliferation of small lymphocytes mixed with a varying number of histiocytes forming nodular or diffuse pattern. We can also see the presence of polyploid type of RS cell in this. Under low magnification, we can see diffuse effacement of lymph node architecture, less common than nodular growth. In high magnification, we can see proliferating lymphocytes, histiocytes, and polyploid RS cells. The second one, nodular sclerosis type. It is more common in women than in male. We can see bands of collagen and nodules in this, and also the presence of lacunar type of RS cells. In low magnification, we can see bands of collagen, which is pink in color, and nodules, cellular nodules over here. Well-defined bands of pink collagen. Collagen divides tumor into nodules, and there is an appearance of moth-eated over here. In high magnification, we can see lacunar RS cells with multilobe nucleus and presence of neutrophils and scarce area of collagen. The third is mixed cellularity type. This involves both pediatric and older age groups, and we can see the presence of classic RS cell in this, and some amount of fibrosis and focal area of necrosis are generally present. Low magnification, we can see mottled appearance due to aggregates of epithelioid histiocytes throughout the lymph node. In high magnification, we can see lymphocytes, eosinophils, and the main classic RS cells, plasma cells, and histiocytes. The fourth one is lymphocyte depletion type. The lymph node is depleted of lymphocytes, and we can see presence of pleomorphic RS cells. There are two variants of lymphocyte depletion, diffuse fibrotic variant and reticular variant. Under low magnification, we can see abundant atypical RS cells, very few lymphocytes, and heavy reticular fibrosis. In high magnification, we can see diffuse fibrosis, pleomorphic RS cells, depleted lymphocytes, and Hodgkin cell. The second classification according to WHO is nodular lymphocyte predominant Hodgkin disease. This is 4:1 male predominant, and there are two forms of growth pattern observed in this. One is nodular growth pattern and second one is diffused growth pattern, and there is also a presence of polyploid type of RS cells. In low magnification, there are two variants, diffuse pattern and nodular pattern. In diffuse pattern, we can see diffused growth and lack of nodules, and in nodular pattern, we can see nodules with light pink areas of epithelioid histiocytes. In high magnification, we can see popcorn RS cells. The popcorn RS cells are covered by lymphocytes in a rosette manner, as you can see here. Now let's see some of the macrospecimens. Under classic Hodgkin's lymphoma, we have the nodular sclerosis type. The organ is spleen and the size is enlarged. Area of light grey color on a dark red background are visible on the cut surface in the spleen tissue. These are the foci of tumor growth. The specimen looks like a porphyrin stone, that's why it is called porphyrin spleen. The second one is classic Hodgkin's lymphoma nodular sclerosis type. The specimen is lymph node, nodular appearance due to the bands of fibrosis. Consistency is firm to hard, consistency due to fibrosis. The size is massively enlarged, as you can see with respect to the scale. The uniformity is heterogeneous. Grayish-white fibrinous band surrounds individual nodules. The third macrospecimen is classic Hodgkin's lymphoma mixed cellularity type. Lymph node of a patient presented with inguinal lymphadenopathy. The specimen is lymph node. Size is enlarged in size. As you can see, 1 cm scale, with respect to that the lymph node is massively enlarged. And the cut surface is fleshy homologous. The consistency is flabby. And there is a lack of nodules and fibrinous bands. Thank you and have a nice day.